Om Swastiastu, we are from SGD B2. Today we are going to present our student project presentation entitled Crohn disease. But first, let me introduce our team. And here is the outline for our presentation today.
My name is Josephine Dila with the last 3 digit of ID number is 094. Here I want to explain about the introduction of our student project. Our digestive system has a system to assist us in killing various germs and adapting to food we eat. The system can also work ineffectively because of the dietary or the system itself. Autoimmune disease of the digestive system occur when the immune system attacks healthy cells in the body. An example is Crohn disease. Crohn disease is an inflammatory bowel disease that attacks various sites in the gastrointestinal tract. The exact cause of Crohn disease is unknown. In Indonesia, this disease has an incidence of 0.27 per 100,000, and this disease is relapsing. Most of the relapsing patients of this disease report significant obstruction in their daily activity. This disease leads to poor quality of life because of the most patients experience remission and relapse at unpredictable times. Based on description above, due to frequent occurrence of Crohn disease case and as an effort to fulfill the assignment, our group discussion interests in making a student project with the topic of Crohn disease. These are the problem formulation and the purpose of the student project. The benefit of this student project for medical students include complete knowledge of Crohn disease from the definition, pathophysiology, risk factor, sign and symptom, diagnosis, treatment, and prognosis. The benefit of scientific learning is that we can learn about more about Crohn's disease and know how to treat it. The benefit for the community is increasing knowledge to have a better understanding about Crohn disease and the appropriate therapy for it. That's all for me. Thank you.
My name is Dea Kalistandana Putri with 3 last digit of my student number is 129. Crohn disease is an inflammatory bowel disease that is characterized by chronic inflammation of any part of the gastrointestinal tract from the esophagus to the anus, but most involve small intestine, especially in terminal ileum, colon, and multifocal. Its manifestation depends on the location of involved intestinal mucus, however, it could also occur extraintestinal. Several factors have been implicated in the cause of Crohn disease, including immunological, genetic susceptibility, and environmental factors, but the cause of the disease remains unknown.
My name is SGD B2, and the last 3 digit of my student ID is 075. Now, I will explain about the pathophysiology of Crohn's disease, which is multifactorial. In the genetical aspect, NOD2 polymorphism is the main case that currently well recognized. The NOD2 gene product itself is a member of NOD-like receptor NLR family that belongs to a cytoplasmic protein class with a capability of detecting microbes. Some polymorphism that affects NOD2 expression in someone's body will cause a decrease in effectivity at sensing gut commensal bacteria and resulting in initiation of chronic inflammatory responses against normally well-tolerated microbes. But the genetical aspect doesn't stand alone in contributing Crohn's disease pathology. There are also environmental, infectious, and immunological factors. The initial lesion in Crohn's disease progression starts as an infiltrate around an intestinal crypt. Ulceration then progresses and followed by inflammation process and non-caseating granulomas formation. This feature will lead to various typical Crohn disease pathophysiological features such as skip lesion, cobblestone mucosal appearance, pseudopyloric or pannate cell metaplasia, and also a vitamin A deficiency features such as bite spots, corneal ulcer, and keratomalacia due to fat-soluble vitamin malabsorption.
Thank you for the opportunity. My name is Diana Ningrum, and I will explain about the risk factors. The incidence of Crohn disease is reported to be higher in the last few decades, with the case reported being different for many factors. Through this, it can be seen that the risk factor of Crohn disease include, first of all, is genetic. Through data, Crohn disease is a multifactorial disorder which is based on genetic and environmental factors. As many as 15% of all Crohn disease patients report having a family history, with the risk increasing by 1 in 3 if both parents also have a history of heredity. The second is smoking. The risk of Crohn disease increases twofold in smokers, including passive smoking. The trigger has been believed to be nicotine, but results of trial do not support this hypothesis. The third is diet. Long-term fiber intake is an observational study is associated with a lower risk of Crohn's disease. Fiber from food was the greater risk reduction factor. And the fourth is lifestyle. The three most important lifestyle-related incidents of Crohn's disease include sleep, stress, and exercise. There is a relationship between the incident of Crohn's disease and sleep, which can worsen the inflammation.
Hello everyone, my name is Anna Agung Istri Aryangdeni with my last three-digit number is 233. Now I will continue the presentation about risk factor in Crohn's disease. Next is appendectomy. There's a study which shows that there is a paradoxical relationship between appendectomy and the incidence of Crohn's disease. A higher incidence of CD was found in patients who had undergone appendectomy either for acute appendicitis or mesenteric lymphadenitis. Next is microbiome. A study by Terfield Method identified agent invasive Escherichia coli to have a higher prevalence in patients with CD. Dietary patterns also influence change in the composition of the gut microbiota, which can mediate the risk of incidence of Crohn's disease. Next is medication. Certain types of drugs are potential risk factors for Crohn's disease, such as antibiotics, aspirin, NSAID, and oral contraceptive. The use of antibiotics during the first year of life may be associated with the development of Crohn's disease. And the last one is vitamin D. High level of vitamin D show a significantly lower risk of Crohn's disease. Meanwhile, low vitamin D level is associated with increased risk to CD or Crohn's disease. Maybe that's all that I can say, and for the next explanation will be explained by my friend. Thank you.
Hello everyone, my name is Grace Valerie with the last three-digit number of 143, and in this presentation I'm going to present about the signs and symptoms of Crohn's disease. Symptoms experienced by patients vary from one to another, but the most common one is gastrointestinal tract symptoms such as persistent diarrhea, rectal bleeding, urgent need to move bowels, abdominal cramps and pains, sensation of incomplete bowel evacuation, as well as constipation that can lead to bowel obstruction. Patients can also experience other symptoms like high temperature, feeling and being sick, joint pains, sore and red eyes, patches of painful red and swollen skin that commonly seen on the legs, as well as mouth ulcers. That's all from me. Thank you.
My name is Rustanya Trikira with the last 3 digits of student ID number is 199, and I'm going to talk about the diagnosis of Crohn's disease. There is no gold standard in the diagnosis of Crohn's disease. It is in fact diagnosed by a combination of inflammatory pain in the GI tract and elimination of other causes of inflammation. First, it's really important to take anamnesis of the patient. Patients usually complain about abdominal pain and diarrhea. In clinical findings, it is really important to check the vital signs, and it's really also important to check abdominal mass, abdominal distension, and abdominal tenderness. In rectal examination, fissure, fistula, and abscess are very often found in Crohn's disease. In radiology, computed tomography enterography, or CTE, can be performed if the patient can tolerate contrast injection. And magnetic resonance enterography, or MRE, is more expensive, but doesn't use contrast ions and minimizes radiological exposure. The rest of the methods are histology, laboratory tests, and endoscopy, and that would be explained by the next presenter. Thank you.
Hi, my name is Gladys Falishaldan with student number 110, and I'm going to continue about the diagnosis of Crohn's disease. Crohn's disease diagnosis can also be helped by finding histological findings such as non-cacheating granulomas, submucosal fibrosis, and also transmural infiltration of inflammatory cells. With laboratory tests, we can also check by tests such as fecal protectin, complete blood test, and then pregnancy test, erythrocyte sedimentation rate, by checking also levels reactions C protein levels, and also checking complete metabolic panel. And lastly, we can also use endoscopy to view the severeness of the Crohn's disease by checking mucosal friability, granules, purulent exudate, erythema, and also edema.
My name is Stella Angeline Isvianto, and my last 3 digits are 142, and now I will explain about the non-surgical treatment of Crohn's disease. So, the cornerstone of Crohn's disease therapy is corticosteroids like budesonide and prednisone. And the use of antibiotics are recommended for patients who have perianal problems like abscess. And immunosuppressants like thiopurine and biologic agents have shown efficacy in maintenance therapy of Crohn's disease. In high-risk patients, anti-TNF medications are the first line of treatment. Ustekinumab and vedolizumab are typically preferred over thiopurines in clinical practice. And in patients with severe extraintestinal manifestations like uveitis, ankylosing spondylitis, or pyoderma gangrenosum, anti-TNF medications are preferable.
My name is Evania Ecclesia, and the last 3 digits of my student ID number is 127. There are several surgical techniques performed in Crohn's disease, which is depending on the site and the disease behavior of Crohn's disease. The first one is bowel resection, which is the most prevailing surgical treatment for Crohn's disease. The principle of bowel resection is to remove the diseased part of the intestine and reconnect it with a healthy part of the intestine. The second one is structuroplasty, or the bowel preserving surgery. The principle of this surgical technique is to repair stricture caused by the disease without having to remove any bowel. The next one is colectomy. In severe cases of Crohn's disease, this disease affects the colon, and colectomy may be necessary. The next one is protocolectomy, which is the removal of the entire colon, rectum, and anal canal. The next one is abscess drainage. Crohn's disease can cause abscess in the abdominal cavity. In order to prevent infection from spreading, abscess drainage is needed. And the last one is fistula repair. A fistula is an abnormal connection between different parts of the intestine. And fistula repair surgery closes the abnormal connection and restoring normal bowel function.
Let me introduce myself. My name is Dinis Wijaya with the last 3 digits of student number is 027. Now let me continue the presentation with the prognosis of Crohn's disease. So Crohn's disease is a chronic inflammatory disease that has no curative treatment. Data shows that about 50% of the patients will develop recurrence and need to undergo the second surgery within 5 years. Post-surgery pharmacologic therapy remains unclear to prevent patients from developing recurrence, and this is also will impact to their quality of life. The site of the disease is also playing a role in prognosis of patients with Crohn's disease. Proximal disease is suspected to have worse prognosis and cause higher mortality rate than the distal disease. Laboratory markers that were associated with bad prognosis when the diagnosis was made including anemia, hypoalbuminemia, lymphocytopenia, and also the increased ESR levels. Patients who have undergone surgery usually will have a colonoscopy examinations for 6 to 12 months after surgery within the first year. The next part will be explained by my friends. That's all for me. Thank you.
First, let me introduce myself. My name is Danisa Putridita with the last digit number 005, and today I'll read our student project conclusion. So in conclusion, Crohn's disease is an inflammatory bowel disease that categorized as chronic inflammation. Crohn's disease can occur due to several risk factors such as genetic, lifestyle, appendectomy, microbiome, medication, and vitamin D. Crohn's disease signs and symptoms experienced by patients are vary from one to another because Crohn's disease itself can affect any part of the GI tract, but the most common Crohn's disease symptoms include persistent diarrhea and rectal bleeding. Unfortunately, until now there is no gold standard for diagnosing Crohn's disease, but still there are some methods that we can use to diagnose Crohn's disease. This includes using clinical findings, histology, radiology, laboratory, and endoscopy. Crohn's disease pathophysiology characteristic appearance can be found in histologically. It is non-causating granuloma, submucosal fibrosis, and transmural infiltration of inflammatory cells. After confirming the Crohn's disease diagnosis, non-surgical, surgical, or both treatment can be offered to the patient. Non-surgical treatment include using corticosteroid like budesonide and prednisone for the remission, and using immunosuppressants for maintaining the remission. Surgical
Treatment can be performed when non-operative treatment is ineffective or more harmful. Surgical treatment includes bone resection, colectomy, abscess treatments, and fistula repair. But principally, until now, Crohn disease has no curative treatment, and about 50% of the patient will develop recurrence and need to undergo to second surgery. So therefore, Crohn disease has poor prognosis. So that's all from me. Thank you.
So that's all about our presentations about Crohn disease. We do apologize for any mistakes during the presentations. Thank you for your attention. I'll close the presentation with Paramasanti. Om Santi 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 Om.